Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Bala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us today from Shoreview, Minnesota, the gateway to the north coast of America, of the United States. So it's great to have you with us. We've been doing a series on whiplash, type injuries, what can happen. And if you haven't been with us on previous shows, you can pick them up out there on the internet. Is that what you do?
Yes. Yes.
How do they do that? They go out there to www.housecalltv.com.
3 W's.
www.housecalltv,
no spaces.
no spaces,
.org.
.org, is it?
Yeah, I believe it's .org.
Is that right? Huh?
They've got it up on the screen
there
for you.
It is. There's a .org.
It's a .org. Okay.
And so you can download into your computer previous shows we've done, and we invite you to do that. And yes, we do receive your emails and your telephone calls, although on the emails we have to be very careful about medical information because of HIPAA laws and things like
Right.
that. But we're happy to talk with you on the telephone as well. So Dr. Jensen is going to do a brief review of what we covered. I think we only got through about 3 or 4 slides of the previous program, and so he's going to do a brief review of that.
Very interesting.
Very interesting. Okay, let's go.
Okay, so we're going to look at this first slide here, and what we're doing is we're looking at the kinds of injuries that could take place. And I'm just trying to catch you up real quick where we are. If you have in an auto accident, so many times injury takes place to the ligamentous structures, and that's what we're showing here in this one here, is that there's a ligamentous injury in the back and in the front due to the characteristic of a whiplash type injury. And many times these injuries, being to the ligaments, these ligaments are generators of a great deal of pain. And so right here I'm looking at the anterior longitudinal ligament. Then there's a posterior longitudinal ligament, which is in the front of the spinal canal on the back of the vertebral body itself, okay? Where these are the bodies, that's the main portion that has the discs between the 2 big parts here. And then you have the posterior elements, which have the joints to the spine here. And then we have the windows here, in which the nerves, arteries, lymphatics, veins all flow to and from the spinal cord in order to keep that well nourished, as well as carry the spines out to the nerves out to the rest of the body. As we go on from here, we're looking at a whiplash accident. Many times when you're in a whiplash accident, you're hit from the back. And when you're hit from the back, it's kind of like, if you come back to my camera here for a moment, we're going to look at that my fist is the head, and that my forearm is the body. And this is the back, this is the front. And if you're hit from the back, from the laws of motion, that an object at rest tends to stay at rest. So when you get hit from the back, the body is pushed forward from the seat, and the head likes to stay in place. And that's where we get this hyperextension accident. And then a lot of times what happens is our foot is on the brake, just by instinct to push on the brake, or we hit a car in front of us or something to that nature, and the seatbelt stops the body, and the head is now in motion and gets flung forward. So you get a hyperextension, hyperflexion injury. And the hyperflexion hurts the back of the neck, hyperextension hurts the front of the neck. So if we go back to the slide, you can see here where the head has been flung back from the type of accident. And so what we can have are 2 injuries that occur. One is a ligamentous injury in the front, where we have a ripping and tearing of the soft tissues. And then in the back, we can have the bones that come together, and they can actually have bone chips that are created where we break off pieces of these little levers in the back, which we call the spinous processes. Those are the bumps that you usually see in the middle of the back on a person on the beach. Where you're at the beach, you see these little bumps in the middle along the spine. That's what those are.
And that type of fracture is usually called an avulsion type fracture.
Well, there's an avulsion fracture is where where the ligament has stretched and has pulled off the bone.
Mm-hmm.
So that
person isn't going to have
front.
be a paraplegic or anything like that.
Right. And on the back, it's more towards the hyperflexion injury, where they're stretching the ligaments in the back, where you get those avulsion fractures along there.
And I've, over the last nearly 50 years, had people come in who have been to physical therapists, massage therapists, and chiropractors, never been x-rayed. And here they're treating that thing and actually moving that piece of bone around every time.
Oh,
and
sure.
actually the patient can't figure out whether they have worsening problems as they're getting older because nobody properly diagnosed it to begin with. Thus, if you don't have proper diagnosis, you have therefore malpractice.
Right. And so you want to see if those things are there. Maybe give them a chance to heal, because if you take a broken bone and you continually move it, say over those next 6 weeks, what happens is that you'll actually the body will create another joint in there where the muscles and the ligaments weren't meant to move that joint under control. It's just a free-flowing joint.
Yeah. And often then, because the ligaments and muscles and tendons aren't treated correctly, they start to fill in with calcium.
Right.
They lose their flexibility and elasticity, so we have chronic problems.
What's more than that is if you have one segment that's lost its flexibility, the next segment up above will try to make up for that loss of flexibility and therefore start to have hypermobility. And what the body wants to do is the same thing that it did with the one below, is start to put calcium and things like that in there to help shore it up. Calcium is the cement of the body. And so that's how you start to have arthritis, because that's what the buildup of calcium is. It'll start to create that arthritis on the joints going up and the joints going down.
So if those issues aren't ruled out within the first weeks or few months after an accident,
Sure.
you can pretty well figure that maybe they're going to really have some problems later on.
You'll start to see degeneration of that spine that will change within 6 months. And then it'll go on from stage 1 in, say, 6 months to stage 2 in a year. And on forth to at stage 5, it can be completely fused.
And we can look at some
in
x-ray
about
pictures
5,
of it
6 years.
later on, huh?
We could, yes. So then our next slide here is we're looking at, we're going on from the ligamentous injuries. We're now looking at the muscle injury that can take place. And where we're looking at the scalene muscles, let me bring it up in here. We've got the scalene muscles in here. We've got the splenius capitis muscles that are back in here. So a lot of times people will start to have headaches that ring around up over to the in front of the eye from the splenius capitis. Then the sternocleidomastoid muscles here. And many times if you have an injury to that muscle, it'll give you headaches right behind the eyes also. These things don't just manifest at the place. There's patterns of manifestation.
And that's why it then is so important that not only is that a postural examination is done with an orthopedic range of motion to see if those muscles, not only if they're working correctly or if one is larger than the other and the other is smaller than the other.
Sure.
And that often then causes the head to tilt to the side or be backwards like that.
Right.
So if we're not recording that with digital pictures, there's a major mistake made. And then following it up with an internal picture of the bones, muscles, and ligaments.
Right, because if
Through
you
an
look,
X-ray.
if you look at the bones, it's like the wire structure of the body, and then you have of that structure, the muscles move that structure around too, so it could have both components. And one of the things we were looking at this muscle with the scalenes here, many times if you have injury to the scalenes, you'll start to have tingling in the hands also. And it's not necessarily just due to the spinal cord type injury, it's due to the peripheral injuries that have occurred also.
So in a way, it could be, I guess, similar like to a bridge that has all kinds of spans. They could be metal spans or either concrete spans. If one has a slight crack in it or some structural defect, the platform of the bridge is ultimately going to go.
Right, right, as illustrated here in Minnesota. So then we want to look at, now we've looked at the hyperflexion or hyperextension injury, let's look at the hyperflexion injury also with this one, where we were looking at before, where we had where the spinous processes were against each other as when the head was backwards, and that they could break here and cause ligamentous injury here. Now we're looking the opposite view, where we can actually have the ligamentous injury occurring in the back of the neck, and having bone-on-bone injury here, where we cause what they call a limbus bone here to break off from the vertebral body, as well as what you were talking about earlier with a ligamentous injury causing an avulsion fracture in the back.
How about down below? Aren't there some ribs, upper ribs and clavicle and
Here's
scapula
the
there?
first rib, second rib, and by the way, the lungs are right underneath this rib. So your lungs are quite a lot higher. That's always surprising to patients when they find out that their lungs actually travel up that high.
That would be the apex of the lung, like a mountain peak up there.
The apex of the lung is up here. And many times those muscular injuries will create injuries that hold up these ribs. And those ribs are the things that help open and collapse the chest cavity so that the lungs act like a baffles. Okay, and as you open them, there's an inhale. As you close them, it's an exhale. And many times those injuries hold these up. They have spasms and they won't collapse. So these people actually have a harder time breathing.
And that's one of the reasons why in all of our new patients, but particularly in whiplash type of injuries, where we do a vital capacity test on them, where we have an instrument that measures how much oxygen they can expel.
Right.
To see if they fall within the normal range for a person of their sex, their height, and their age.
Right.
And then if you see a diminishment, you say, gee, maybe some issues are going on here within the spine. And then if we treat them and we re-examine them, of which they should be, we can measure to see if that oxygen capacity is increasing.
Absolutely. Absolutely. So then, as we look at this next one, they're looking at spinal cord injury in this case. So as the injury in the front, where we have some breakdown of the soft tissues that hold the vertebrae in place, we can actually have a failure of the disc with injuries. And therefore, what happens is we start to have a compromise of the spinal canal here. And this can cause a whole plethora of other conditions.
I think this is a good slide that shows a cross-section of the brain here. We should probably spend a moment or talking about that
when we're
brain injuries.
We're looking at the brain injuries where the brain gets forced forward in the cranial vault here. And the brain gets injured against the front part here, and here we have some blood that's accumulated in here, and that's affected the temporal lobe, which is hearing, and the frontal lobe here. In fact, the very tip of the frontal lobe works a great deal in judgment, and we see that, say, with somebody who's on drugs or alcohol, have that same impairment of judgment. And so that's one of the reasons why we look at like DWIs and things like that, where this is accident-induced. So we want to look at that there. And plus, you might have swelling in there. And when you have swelling, you have this thing pushing against the inside of the vault, which is creating stimulus to the brain. And that stimulation to the brain then interprets as it can to try to make sense of it, and so that people can start to hear sounds, and they can start to see or hear things that may not be there, almost like an accident-induced schizophrenia.
I know just yesterday I had a patient say to me about her husband. He had been in an automobile accident. We were caring for him, and she said to the nurse in the clinic, well, could I talk to Dr. Lala for a minute? And that's fine, okay. And she said, Dr. Lala, I want you to know that I'm starting to get my husband back. Now, there didn't appear to be any brain injury, but the accident had caused that brain to be jarred, that it began to change his personality, and she was so grateful that her husband was starting to become himself again. Well, we're going to take a look at some research here with reference to injuries to the spine. A study at Mayo Clinic with reference to multiple sclerosis and Parkinson's disease. That's recorded in the Journal of Vertebral Subluxation. This is way back in August of 2004. That 78 of 81 patients suffering from multiple sclerosis and Parkinson's disease recalled previous injuries to the neck. Then there's another, isn't it interesting? Look at that. Here's Mayo Clinic, a study at Mayo Clinic that multiple sclerosis and Parkinson's disease victims, 78 of 81 patients suffering with multiple sclerosis and Parkinson's disease recalled previous injuries to their neck. Now that didn't show up overnight. This showed up months and years after the neck injury.
A thing to note, 78 of 81% of those patients with these diseases, 78 of 81 is well into the 90 percentile range.
And it's so interesting then, maybe we can't cure that multiple sclerosis or the Parkinson's, but by getting that spine and nervous system loosened back up correctly, it stops it. Mm-hmm. And they can still live a normal life rather than be sent in some nursing home or be on drugs in a semi-vegetative state as they get older.
It's very interesting when you're looking at an upper cervical injury like that. There is a talk show host that has multiple sclerosis. And he came on, I would say it's within a few years here. He had his first chiropractic
You can
treatment.
mention his name.
I'm trying to remember.
I know he's an Afro-American.
Yes.
Forgot his name now, but it's all right. Sorry.
No. It's not
Arsenio Hall.
No, it's not. But he came on and he said after the adjustment, he had been in so much pain that when he was talking on the show, he had to keep switching his posture and things because of how he would move to stay out of pain. Mm-hmm. And after his first adjustment, he was in so much, the pain had gone down so much that it was just a miracle for him. And it's not that everybody gets that miracle, but they happen often enough that people who have those types of injuries should seek out chiropractic care.
And that's why it's not a surprise to our patients who see people coming in that kind of are manifesting as they come in the reception room with MS or Parkinson's. They're saying, boy, they're in the right place because these chiropractors know what they're doing when it comes to MS and Parkinson's, see?
Right.
Rather than just becoming another walking drug factory. Well, there's another interesting study that you can find it out in WebMD. Medical News study finds special atlas adjustments. That's the first cervical vertebra up here in the neck, lowers blood pressure. And that was reviewed by Louis Chang, MD. And what it amounts to is that 26 patients diagnosed with hypertension or high blood pressure had a significantly lower blood pressure than 25 similar patients who underwent a sham chiropractic adjustment. So they took a group of people and they had an x-ray of their neck, had the x-rays of their neck and a very good examination. They found subluxation of the atlas vertebra, the first vertebra. They adjusted that atlas vertebra over a period of time, and those people's blood pressure went down an average of 14% AHG. Then they had another group of people that they had high blood pressure, but they really didn't adjust the bone. They made the patient think that they were adjusting the bone. And so again, 26 patients diagnosed with high blood pressure, hypertension, had a significant lower blood pressure than 25 similar patients who underwent a sham chiropractic adjustment. That means that 14% average greater drop in systolic, that's the top blood pressure, and an 8 mm diagnostic or diastolic blood pressure. And that's significant because the American Heart Association basically says that anybody with blood pressure above 140 systolic should be on medication. Well, many times, many of those people who do not have an organic issue within their heart, some valvular defect, some defect in the heart itself, if they would receive chiropractic care, they would not have high blood pressure and or they would not have to be on antihypertensive medication. That's the fact of it. It's so, and we see that We see that because we measure people's blood pressure on their initial examination. I can't believe that a person would ever go to a chiropractor initially and not have their blood pressure checked sitting or standing, as well as periodically checked. It just doesn't make sense to me. It just doesn't make scientific sense to me. But there's a lot of these people out there who I don't think are doing their job, but again, that's my opinion. So, Dr. Jensen, you were going to start looking at some x-rays now of people who had injuries to necks?
Certainly. Well, we're going to take a look at this. This is actually phase 5, and this is what can happen to a neck that hasn't undergone treatment for 5 years or more, or should have had treatment about 5 years ago. And in this case, what has happened is they've had a complete loss of that cervical curve that we talked about in the last episode, where that curve is meant to distribute the forces throughout the neck.
So there's the front of the vertebra is in the center of the screen?
The front of the vertebra is right here.
There, and the back is
and the back is back here. These are those little piano keys that we talk about.
That's the bottom of the occiput there of the skull bone?
This is the bottom of the skull.
And then the foramen magnum, that's a hole in the bottom of the skull.
That's the
from
hole
which the
here.
brainstem passes through and starts the spinal cord.
Pass through this spinal canal right through here. This is the atlas. This is the axis, and the axis, you know, has a little like a pivot.
A tooth-like, isn't it?
It's a tooth-like thing. It's called the odontoid because it's tooth-like, but basically it's a pivot for the ring of the atlas to spin around.
Serious when those get fractured off, huh?
Definitely, definitely.
Don't ever let any chiropractor, massage therapist, physical therapist do any work on your spine without x-rays, folks. Believe me, folks.
If this falls back into the spinal canal, then you've got your brainstem right here.
Yeah.
And here they talk about people who have head injuries. Sorry, we'll go right back here. People who have had head injuries that if it's above this level here, that they can't breathe on their own. So next thing you know, you have a breather that's in there.
So there have been disc injuries there as well now?
No, there's no disc between these two. There, you start your discs at C2 to C3. So, but you can have injuries where that posterior longitudinal ligament we were talking about, if that gets ruptured, that can put pressure back in here. And of course, when we're talking about a shifting forward of the vertebrae here,
Boy, that's way out of alignment, isn't it?
certainly is. You have actually a reverse curve here. And so what happens is where you've got all these vertebrae that are not moving here, you start to have calcification. You see the little starting of calcification here, but as you look over here, you can see these little spicules coming out here that is forming calcification around that disc. And you have calcification here. What happens is a lot of times the center, the hydrostatic pressure area of a disc is in the posterior part of this vertebral body. And so what happens is many times when we have an injury to that, it actually starts to put more pressure back here, and you start to have more calcification in this area here, which is fusing this spine so that it won't move anymore.
So those are spinal spurs there then on some of those vertebrae in the front?
On some of these, yes, on some of these vertebrae on the front, there's spurring that's occurring.
Maybe on the illustration there can also be seen back there on the other end. Those are the spurs, and they're there because there's been injury there and the body's trying to build up extra bone.
Right.
And it's actually trying to fuse it.
It's actually trying to fuse it, and what that usually denotes is that there's inflammation in the area, and the body's using the calcium as a response to the inflammation in the area, and it starts to seal up the ligaments that go across the disc.
So it's an abnormal thing trying to prevent further problems, but they're taking that, the body then is taking calcium that's supposed to be on the inside of bone and depositing it on the outside of the bone, and when it's not at adequate levels of density on the inside of the bone, we call it osteopenia or osteoporosis, right?
Correct, correct. And so we're just seeing here how the bone has modeled over the years.
And then over a period of time, like if there's an MRI, very often they say there's stenosis in there then?
Right.
Spinal stenosis.
Spinal stenosis, just meaning that's a closing off of those areas in which you would normally have the passage of the nerves, arteries, lymphatic veins, those kinds of things. And then what can happen is if you have that stenosis and it's putting pressure on those structures, then you will have pressure that, say, if it's a nerve that goes down to your hand, and it says that this person has tingling in the hand, it's interpreted by the brain that's occurring here, where the injury is here. And one of the funny things about that is that the immune system can react down here, causing swelling down here due to an injury that's here that's being interpreted by the brain to be in the hand. I have an uncle who lost an arm in Normandy. And every once in a while, he'll have an itch in his hand that's no longer there. It's because the nerve tracts that now end in the elbow are still interpreted up here as in the hand.
I been in practice a few years, and there are some very good chiropractors. There really are. And Dr. Jensen and I have a pretty good reflection on them because I've taught in chiropractic college, had taught in chiropractic colleges for many, many years, and taught seminars, what are called continuing education seminars, that are certified by various chiropractic boards of examiners and for license renewal. And so there are a lot of chiropractors that have attended these seminars, and also I've done a lot of work for insurance companies and for law firms on the plaintiffs and defense side. So I see a lot of records, a lot of x-rays and things of that nature. And so I see some very, very good chiropractic care, the kind of chiropractic care that they're educating these young men and women in chiropractic college to perform. On the other hand, we can't control what somebody does once they get a license. We can make them get so many hours to renew their license every year, and that's about it. That's about it. So we really don't know if they're doing their job or not. And in this day and age, there's a lot of corner cutting and things like that. There's a lot of people out there whose goal is to do nothing but make money or to just get by and stuff like that. An examination, a good examination, takes time. Somebody who's running you through like this, you know that somebody's cutting corners. You may not know that because you're a layperson, but we know that. The other thing is that when I review files of malpractice, or there's been malpractice of a physical therapist, a chiropractor, massage therapist, and things like that, it almost inevitably it comes up that there are very poor records. There have been no x-rays, or where there have been x-rays, there have been minimal x-rays, or there have been very poor quality x-rays, and somebody's just not doing their job. And to go and have somebody manipulate your neck, to give an adjustment to your neck, to work on muscles, to put you on equipment, to treat you, or to put you on machines, and not have adequate x-rays of that area and an adequate postural, orthopedic, neurological examination is getting close. And I mean, it is terrible, because I may have a great personality, and you may think because I have a wonderful personality that I'm a good doctor. Personality has nothing to do with being a good medical doctor, a good chiropractor, a good physical therapist. It doesn't. But in this day and age, we say, well, how to win friends and how to influence people, have a great personality. Well, usually it's the schmoozers who are the lousiest doctors. It really is. And certainly I should be a good person, but I should look at you, if I could put it in this context, that I would, if you were Jesus Christ and you walked into my clinic, would I not x-ray you? Would I not take time to do an adequate examination? Would I turn out poor quality x-rays? Would I treat you based on what your insurance will pay rather than what your history and your examination and x-rays show that you need? There's a big difference there. And so be very, very careful. Make sure that if you've been in some kind of an accident or injury, that you get yourself to a good chiropractor who has a reputation of being good. A reception room full of patients does not indicate that I'm a good doctor. What it indicates is that I'm probably not a great doctor and that I'm always behind in schedule. So take good care of your health. It'll profit you. It really will.
House Call has been brought to you by the Fellowship of the Great Physician. For further information, telephone us in care of Dr. Laura or Dr. Jensen at 651-484-8521 or visit our website at housecalltv.com. today.